Dear colleagues, a warm welcome to the third OncoAlert Colloquium, this year being held in partnership with the American Society for Radiation Oncology, the European Cancer Organization, the European Society for Gynecological Oncology, the European Oncology Nursing Society, the European School of Oncology, eCancer, the International Society for Geriatric Oncology, the Multinational Association of Supportive Care in Cancer, and the SWOG Cancer Research Network. Together, we bring you this end-of-the-year review of the Best of Oncology 2022, from trials to publications, drug approvals to current controversies within our field and future trends in treatment and research. This colloquium will last 6 days from January 23rd to January 28th, 2023. Links will appear on social media, and you can always find them via our website, OncoAlert360.com, and there you can find the colloquium webpage. You will find the possibility to subscribe to our newsletter, and we will send you the links daily. This colloquium is independent of any financial support and comes to you as a result of our partners and our faculty working hard in order to drive the field forward, regardless of geography. There is no sign-up, no information acquired or tracked. You simply click and watch. We truly hope that you enjoy this colloquium as much as we enjoyed making it. All the presenters have added their Twitter accounts at the bottom, and this was done in order to facilitate networking, contacting, and education. The days are separated by specific tumor groups, and our aim was to give you as much of a multidisciplinary approach as possible. Although we apologize to our surgery colleagues, we promise to have this included for our fourth colloquium. The daily links to the colloquium will be active at 12 noon EST, New York time, and 6 p.m. CET, Stockholm time. Once the presentation has been streamed for the day, it will be available to you on demand, and we highly encourage you and thank you for sharing it with all your colleagues at your institution to truly amplify the knowledge coming out of our faculty. Another way of receiving the links daily is always by signing up to our newsletter at www.oncoalert360.com. Today is day 6 of the colloquium, focusing on the EONS sessions, along with ESO and a special presentation for COVID and cancer. Our amazing faculty is Dr. Virpi Sulosaari, Pres.Elect of EONS, Merel van Klinken, RN of the University Medical Center Utrecht in Netherlands, and Nicolina Dodlek, RN of the University Hospital Center Osijek in Croatia. Continuing with the ESO sessions on education and improving outcomes by Alexander Eniu and Dr. Maha AlSendi. Now, without further ado, Ms. van Klinken.
Hi, thank you so much for having this EONS session, and thank you for having me presenting something to you about the EONS prevention plan. My name is Merel van Klinken. I am a cancer nurse and a palliative care consultant in a cancer center in the Netherlands. I am also an executive board member of EONS and a co-chair of the advocacy working group. The European Oncology Nursing Society have initiated the PrevCan project. This is a cancer prevention campaign involving research and education. Its aim is to reach a wide proportion of European population with evidence-based, reliable information on how to prevent and reduce cancer risk. This campaign is run with ESMO as a key partner. So why has EONS initiated this? We know that cancer incidence is increasing globally. WHO estimates that 30 to 50% of cancers are preventable, and EU estimates that 40% of all cancers are preventable. However, cancer prevention still receives little attention in many European countries. The PrevCan campaign is in line with Europe's Beating Cancer Plan, which aims to improve access and comprehension of cancer risk factors. It also provides information and tools to people so they can make healthier choices. And they have a specific goal of raising awareness among the general public so that at least 80% of EU population are aware of the European Code Against Cancer. The PrevCan campaign offers great opportunities to impact people's health and to address the extensive problem of cancer-related health literacy, which plays such an important role in adopting preventive behaviors. Traditionally, cancer nurses have mostly been involved in secondary and tertiary cancer prevention, mainly working with patients and families already affected by cancer during treatment, follow-up, and the survivorship phases. Here, nurses have a unique role in educating patients and their family members and carers on cancer prevention and risk reduction strategies. This works efficiently in some countries already, but better nursing education in cancer prevention is needed to reach out to all people affected by cancer across Europe. Nurses and other healthcare professionals are less frequently involved in primary cancer prevention, intervening with a general public. Here, a more active approach from healthcare professions could have an even larger impact. So why do nurses have a key role in prevention? Up until now, cancer nurses have not had a big role intervening with the general public regarding cancer prevention. Even though nurses are key players in informing and training patients, and, for example, self-breast examination or testicle or skin examinations, nurses have a pivotal role in providing lifestyle advice and cancer screening, for example. Also, health literacy has been described as an important factor influencing attendance of cancer screening programs. So during 2020 and 2021, EONS has focused its cancer prevention work on increasing nurses' awareness and knowledge on cancer prevention, and on their ability to reach out to subgroups most in need of cancer prevention activities. Thousands of nurses across Europe have been involved in these activities. A number of events have already taken place, such as a webinar series on cancer, lifestyle, and safety, different social media campaigns, and news articles and joint letters on cancer prevention. Within the PrevCan campaign, we are constantly searching for ways to reach out better and to different groups. This is why we held focus group interviews with young people with and without cancer experience, immigrants, and people with learning disabilities. This is also related to how the European Code Against Cancer is perceived. These results will guide and impact the campaign to make a better fit with context-specific needs. This way, chances to reach different groups with cancer prevention messages are optimized. So we are already able to show you some preliminary results from these focus group interviews. We saw that people with learning disabilities know the risk and are trying to live healthy, but are reliant on others who may not be as aware. They say supporting staff are not always supportive, and they feel a more positive approach is needed. Immigrants need better information from trusted sources like schools and nurses. They also say they want to talk about benefits of lifestyle changes and not sugarcoat it. They need us to be specific. Young people with no cancer experience say they should not even try to reach out to them using the old media. Influencers can be used, but they would need to be trustworthy and knowledgeable. And like people with learning disabilities, young people want a more positive approach. They don't want to hear what they cannot do. Young cancer survivors feel loneliness when they are with friends. They also experience guilt and shame. They need small step approaches and also positive messages. For now, the PrevCan campaign covers a 12-month period. We have provided campaign materials in 25 languages which can be downloaded from the website you see below. Different partners are involved in the support and dissemination of materials on social media and other platforms. They are involved in one or more EONS campaign activities and arrange their own prevention activities. During this year, there will be a systematic evaluation. And these are all of the partners I just talked about who are collaborating with us on the prevention campaign. So like I said, every month has a new theme within the cancer prevention. In September 2022, a PrevCan was launched during the ESMO EONS conference. The first month was focused around smoking, which is still the most important risk factor for cancer. Campaign targeted information on e-cigarettes and water pipes as well. Following this, November focused on the risk from second-hand smoking. During this month, we tried to raise awareness on the effects of second-hand smoking, specifically for children and young people, and promoting smoke-free cars, workplaces, and homes. December kicked off with a waistline challenge, which will run through until February. Here the focus is on the effects of being overweight, obesity, and cancer. I will discuss this a little bit more later. And what's coming up this year? So next to the waistline challenge, January will focus on physical activity and cancer. The campaign will also include a physical activity challenge. February will focus on diet and cancer with a campaign activity including a lunchbox challenge. Attention to this will also be given during World Cancer Day. Next is alcohol and cancer, where we will organize webinars around this topic. April will focus on sun exposure and risk of cancer. Safe workplaces will receive attention in May with the European Cancer Nursing Day and European Cancer Awareness Week to have even more focus on this. June will focus on radon exposure, July on breastfeeding and hormone replacement therapy, August focuses on cancer and vaccines, and lastly, September 2023 will focus on cancer screening and raising the awareness of the benefits. We also aim to educate nurses themselves on risk factors. For example, nurses should be aware of occupational risks, like exposure to hazardous drugs and radiation. Also, nurses do smoke themselves, although this varies between countries. Studies have shown nurses who smoke are less likely to intervene with smoking patients. Nurses sometimes have problems with diet and weight. We all know the long shifts, unhealthy foods, and the presents we get from patients in the form of cake or sweets. So with the prevention plan, we don't just aim for patients, but also for the nurses. So starting in December and running through until February, which is a good thing, seeing the December month with all of the holidays, the Waistline Challenge is set up. This is actually an EONS and an OncoAlert collaboration. The Waistline Challenge is based on Recommendation 3 in the European Code Against Cancer. The aim is to raise awareness on overweight and obesity as risk factors for cancer among the cancer workforce with a positive approach. So key messages are cancer care professionals need to better look after their health, as research indicates highly prevalence of obesity, poor eating habits, and insufficient physical activities. So drop belly fat reduces the risk for certain cancers. Overweight and obesity are associated with increased risk of 13 types of cancer. So keep your waistline for women below 88 centimeters and for men below 102 to reduce this risk. Core team within EONS and OncoAlert are being active and sharing their experiences, encouraging and supporting others. Short films can be recorded and uploaded to share progress and difficulties. In January, the focus will be on exercise, like I said. This is next to the Waistline Challenge. The focus will be on physical activity and cancer. Campaign activity will include a physical activity challenge with the aim of raising awareness among the general public and also healthcare professionals. In this month, there will be special attention for children and young people, so get moving for your health. So what can you do to help us? First of all, join us in our monthly challenges. Use the hashtags and make use of the downloadable toolkits from our website in your own language. You can also contact your local media and public health contacts to join in and inform your political stakeholders. Also, you can contact the PrevCan partners in your own country and discuss actions and ways to collaborate. And again, Look at our prevention toolkits to have access to existing toolkits, but also to create your own messages. So join us for our Waistline Challenge and the upcoming challenges of 2023. I want to thank you for your attention, and if there are any questions, my contact details are below. Don't hesitate to ask.
Good morning, good afternoon, good evening to all of you, depending on where you are watching and when. My name is Virpi Sulosaari. I'm the current President-Elect of European Oncology Nursing Society.
Hello, everybody. My name is Nicolina Dodlek, and I am European Oncology Nursing Society board member representing Young Cancer Nurses Network.
In this three-part series of video recordings, we are going to talk about well-being at work from the nursing perspective. The three parts include first, introduction on the topic. And in the second part, we are going to look as an example more on compassion fatigue. And in the final third part, we are going to talk about improving well-being at work. We need to start first by talking about what does well-being at work mean. The concept itself is quite complex. It encompasses an individual's appraisal of physical, social, and psychological resources which are needed to meet psychological, physical, and social challenges at work. Well-being can be classified to objective well-being or the satisfaction of physical needs, and this refers to basic needs such as food, clothing, and shelter, and subjective well-being or emotional and psychological support a person needs to flourish. Nurses' health and well-being are affected by demands of their workplace and their everyday work, and then in turn their well-being affects to their work and for people they care for. During the course of their work, nurses encounter physical, mental, emotional, and ethical challenges. Nurses are very committed for caring people with diverse and often complex needs of people with competence and compassion. While nursing is often by many nurses called as a calling profession, we need to acknowledge that it is a very demanding profession. Nurses experience excessive levels of burnout and stress due to the nature of their work and their working conditions. And when we talk about professional well-being, it's important to understand that it is associated with many factors such as job satisfaction, being able to find meaning and fulfillment in work, feeling engaged, and having a high-quality work experience. Is it time to act? We argue that it is. We all know that globally and across Europe, we have severe lack of nurses. And for example, between 2020 and 2030, over 1 million nurses will retire. Therefore, retaining nursing workforce and supporting new nurses is vital to growth and sustainability of cancer care workforce. We really need to focus on creating healthy work environments and investing the long careers by well-being at work of nursing workforce. During the recent COVID-19 pandemic, the demands on nurses have been extraordinary due to their significant role in infection control, isolation, and containment process. However, although COVID-19 imposed new challenges for the profession, it also has offered opportunities to give nurses' well-being the attention it really deserves and address the systems, structures, and policies that create workplace hazards and stresses that can lead to burnout, fatigue, and poor physical and mental health. Nurses experience excessive levels of burnout and stress. They are exposed in their everyday work, challenging job-related stressors such as extensive workloads, short lengths of stay, constant contact with patient and family suffering, nursing shortages, long working hours, and feelings of powerless regarding job control. The consequences if a person ends up with burnout can include poor patient outcomes, high turnover rates, increased cost, and even clinician illness and suicide. There are also other risks for well-being at work. These include incurring the risk of infection and physical or verbal assault, meeting physical demands, managing and supporting the needs of multiple patients with complex needs, having emotional conversations with patients and families, and confronting challenges, social and ethical issues. We also know that there is a high prevalence of occupational injuries among healthcare workers, especially among nurses. These are, for example, needle stick injuries. In oncology, there are specific occupational risks which are related to handling of hazardous drugs and other treatments.
As Virpi already mentioned, in the second part, we are going to speak a little bit more about compassion fatigue. In our everyday work life, we face a lot of challenges: clinical, professional, personal, and person's ability to cope with it. It can impact very much our reaction to stressful situations. So Squares described that personal quality of life and compassion satisfaction impact very much on creating and resulting compassion fatigue and burnout, and also a secondary trauma. He describes compassion fatigue as the convergence of secondary traumatic stress and also cumulative burnout. He says that it's a state of physical and mental exhaustion caused by the depleted ability to cope with one's everyday environment, and it can be impacted by a lot of different factors, internal and external. Figley in 2012 has described a model of compassion fatigue on the caregivers. He says that the process begins with exposure to the client, his empathic concern response that is based on the empathic ability to cope with the caregiver. He says that traumatic memories and prolonged exposure can result with compassion fatigue, which can cause a life disruption. Empathic ability is a cornerstone of the model, caregivers' aptitude for noticing the pain of the others. The concept itself describes burnout and secondary trauma, which lead to compassion fatigue. Compassion is defined as a feeling of having pity or the urgent desire to help or aid somebody, but it can very much impact not only the patient care, but also the relationship with our colleagues and our professional and personal life. Several risk factors can impact our compassion fatigue and ability to cope. They can be both internal and external. Internal ones are our current state of being. Not every person in every moment in life will react the same to some factors which lead to burnout. So we have a physical, emotional, social, but also a spiritual well-being. We have resilience, which we build through our life and career, and also a person's ability to cope with difficult situations. It's very important to develop self-compassion. External factors are more related to the work environment. So most often it's excessive workload, it is difficult shift rotation, but also patients who have pain and who suffer a lot. We have, by Squares, 5 stages of compassion fatigue. So the first stage is an early career stage, when we are enthusiastic and very much motivated for our work, but work overload and all those risk factors can lead us to the second phase, which is called irritability phase. It is a phase of taking shortcuts, avoid colleagues, avoid work, but also avoid the patients. Our enthusiasm is starting to disappear. The third phase, the withdrawal phase, impacts not only professional, but also our personal life. We start to lose compassion for our patients. Our problems are piling up. We don't have ability to cope, and it can also lead to leaving the profession. Figli has also developed a smart formula in creating self-care goals. So he says the goals need to be very specific, both measurable, attainable, realistic, and also time-based. It's important to take baby steps. He has created a smart chart about maintenance, but also growth. So not only to check with ourselves, do we have obstacles and are we resistant to achieving our goals, but also to check with our friends, to ask for help. If yes, what are the obstacles? Check with your body. It's called accountability body to help us to check our goals, the time we need to come to our goals. And the key is self-compassion. We need to be self-kind. It's human to make mistakes. Everybody makes mistakes. So self-care strategy is one of most important strategies to increase our personal strength and also our resilience and ability to cope. It will be a mindfulness techniques, a help of a friend, a help of a family, but we need to learn self-compassion. Compassion satisfaction is defined as satisfaction experienced by healthcare professionals. When we are performing our work properly, it includes satisfaction with relationship with our colleagues, our workplace, sense that work is performed very well. So the crucial is problem solving, but also seeking a social support. It is essential for better clinical patient outcomes, but also our personal life. Self-care. We need to have a holistic approach, so try to maintain the balance from professional but both personal life, because professional and personal are very much connected. One impacts the other. Social connection at work is very important. When we work long hours, night shift, that 5 to 10 minutes to exchange experiences and difficult situations at work can mean very much for us and for our team. So we need to develop a team strength, a social support at work, and develop situations and chances to discuss those difficult situations and memories. It helps, but we also need support from organization. We need a positive workplace. Is it going to be debriefing once a month or educational events to cope and develop resilience? We need to empower each other and we need to empower ourselves. European Oncology Nursing Society Young Cancer Nurses Network has recorded a Nightingale webinar about compassion fatigue and burnout, resilience and balance, personal and professional life. It is available on EONS YouTube channel, but also at EONS website. So please feel free to look. It was developed specially for early career young cancer nurses network who are just starting their careers. So they need to develop resilience strategies and way to cope with difficult situations.
In this third part, we are going to talk about how to improve well-being at work. Unfortunately, there is no single simple solutions how to address the challenges. Instead, we are describing and introducing you some of our ideas how to approach and improve the well-being at work of nurses. First, we need to see well-being at work as a shared responsibility. The responsibility of nurse well-being is shaped between the individual nurses and with those who shape the environment in which they practice. Individual nurses' dedication to their own well-being can be enhanced by support of the system, the leaders, and a culture in which well-being is prioritized. We argue that the system approach, which focuses on the structure, organization, and culture of workplaces, might be one of the most effective solutions. For individual approaches to be effective, these must be coupled with redesigning organizational processes, structures, and policies. Because, for example, for reducing burnout and improving well-being, there is research evidence indicating that these integrated, systematic, organization-focused interventions are more effective than only individual approaches in use. This figure was published by Nasem et al., and it looks on the system model of burnout and well-being. There are external environment, healthcare organization, and frontline care delivery factors which causes and can cause burnout, and these can be called as work system factors. Each of the individuals have their own mediating factors, and if we are successful, we have professional well-being. However, if we are not that successful, this can end up on clinician burnout. The clinician burnout can have severe consequences, not only the individual her or himself, but also to patients, other clinicians, healthcare organizations, and in the end, of the whole society. And the system model starts with an idea of learning, and then through learning, improving the system, how it supports the individuals. To use the systemic approach, we need broad range of stakeholders to be included. These include nursing leaders, educational institutions, healthcare organizations, and other employers of nurses, policymakers, and also the professional associations. The actions can include restructuring systems and implementing initiatives to prevent burnout, reduce administrative burden, enable technological solutions to support the provision of care, reduce the stigma and barriers that prevent healthcare professionals from seeking support, and increase investment in research on clinician well-being. There are also these individual interventions, for example, techniques and therapies which can be used to alleviate burnout and stress and increase well-being. Here is some examples, for example, different type of muscle relaxation, breathing, cognitive behavioral therapy, and different types of educational programs. One of the modern and popular practice seems to be mindful-based interventions. These have shown to have a potential to enhance the well-being of nurses. During the pandemic, Institute for Healthcare Improvement published so-called psychological PPE, personal protective equipment. Although the pandemic is the worst part, hopefully, is now over, we do find this still to be very useful as an approach. We can look at it from the team leader perspective. The team leaders can limit staff time on site and shift. We can design more clear roles and leadership. We need to train managers to be aware of the key risk factors, monitor and react on any signs of distress. And one of the, I think, important part of this is the peer support, so that we can support one another. So meaning of making peer support services available and introducing so-called buddy system. From the individual perspective, it is important for nurses to take that day off and look at your work-life balance and that it is optimal. And in exceptional times and stressful times, sometimes it's just good to close the phone and not to read all the news and the publicity around the healthcare. It is important to seek and receive mental health support and to facilitate opportunities to show gratitude. And this means that you need to thank yourself and others. Sometimes there are these negative experiences, and it is important that we try to reframe them, so learn from them and make the outcomes in the end positive. American critical care nurses published over 10 years ago standards for healthy work environments. Although that these were originally made to critical care nursing context, these have also been adapted to oncology nursing setting and are quite useful approach and one example of how we could, in a systemic approach, improve well-being at work. The aim of the healthy work environments is to achieve optimal patient outcomes and clinical excellence. And by investing on creating healthy work environments, we can reach that aim. I recommend, if you are interested, to look at the documents and all the publications which have been made in different care settings, how these have been adapted and used. In this presentation, I will just show you the basic standards. So the main categories, which are the skilled communication. The skills communication refers to professional skills, the communication with the people affected by cancer, but also with your colleagues and with the leadership and so on. We need to have a true collaboration, genuine true collaboration with each others. We need effective decision making. This needs to be valued, and we need committed partners in making the policy and directing and evaluating practice and leading organization operations. Appropriate staffing is important in regards of healthy work environment. The patient equity and staffing must have an effective match. We need meaningful recognition. So we need to be recognizing the staff and must recognize others for value each brings to the work of the whole organization. From the leadership point of view, authentic leadership is one important approach. Nursing leaders must fully embrace the imperative of a healthy work environment, authentically live it, and engage others in its achievement. A couple of years ago, EONS published 4 webinars focusing on safety at work, some of which are not only the safety, but it is also on culture and effective communication. These are available on our website, and please look and I hope that you find these useful. There are also different language version of these. To conclude, if nurses are not supported in maintaining their physical, emotional, and mental well-being, their ability to provide high-quality care can be compromised.
Looking into the future, we share the opinion that investments are needed to retain the cancer nurses workforce, and also that teamwork and togetherness is the key to face challenges together and also to tackle them together.
Policymakers, employers of nurses, nursing leaders and educators, professional associations and nurses themselves, we all have a role in ensuring the well-being of the nursing workforce. Thank you for your attention and greetings from Finland.
Thank you, and greetings from Croatia.
Hello everyone, my name is AlSendi. I'm a breast medical oncologist from Hôpital Riviera-Chablais in Switzerland, and I'm also the European School of Oncology Deputy Scientific Director and Chair of ESCO, the college of the school. Together with my colleague Maha, we are here and thank OncoAlert for the invitation to discuss some of the achievements that the European School of Oncology had over the years, and particularly focus on one of the courses on improving cancer outcomes and leadership course that we've organized back in 2022. So the European School of Oncology celebrated 40 years this year. It was created by this man, Professor Umberto Veronesi, in 1982, with the goal to obtain a reduction of deaths due to late diagnosis or inadequate treatment for cancer. The school is financially independent, therefore it could set up its own priorities. As I told you, we celebrated 40 years this year in a nice event at the Scala in Milano, and this gave us the opportunity to reflect on what has been achieved over the years. The mission of the European School of Oncology is depicted in this slide. We are dedicated to quality education and training because we believe that all patients deserve equal access to competent cancer care. And our vision is that we want to ensure that all cancer patients have access to unbiased and evidence-based competent care from adequately trained health professionals, which means that actually we are focusing on education, and we've made a point in trying to educate our younger colleagues, especially from countries with limited resources. So what does the school provide? I think we provide a well-structured educational pathway to enhance oncology careers. The goal is to actually help people go from the stage of medical student to an oncology professional, and to ultimately to become an accomplished oncology leader. And we have certain means that we use to do that. We historically started with the masterclass, which is a 5 days immersion into discussions on the main 5 killers, the most important cancer types. We then discovered that it was important to focus on certain tumor types such as breast cancer or lung cancer to go into a more in-depth discussion on those issues. We also understood early on in our development that a placement in a foreign institution outside the country is crucial to be able to develop your career. Therefore, we offered the CTC, the Clinical Training Center Fellowships, which offer a 3 to 6 months placement in the institution of your choice to refine your skills for a certain tumor type. We then developed our postgraduate program that includes certificates of competence for 5 different tumor types, of quite intensive programs, 2 years in length, with where you need to achieve at least 400 credits to be able to obtain a certified diploma from one of the universities with which we collaborate. We then realized that perhaps we need to also start earlier and actually give medical students certain elements that would attract them towards a career in oncology. And for some years now, we've been offering the medical oncology for medical student course. And then this year, we started with the basic oncology course, which focuses on principles that need to be mastered before becoming a oncology professional focused on a certain tumor type. All this was well structured and actually put in a way to prepare you to prepare our students towards becoming an oncology leader. And we realized that that being an oncology leader doesn't only mean to be a good oncologist, but there are certain skills that need to be developed. Therefore, we organized earlier in 2022, in collaboration with ECHO and SPCC, the first Improving Cancer Outcomes and Leadership. And I will a little bit focus on that for the next minutes. mentioning that this is a benefit for those of you who would graduate from the college. We have organized all these events into an educational pathways that constitutes the College of the European School of Oncology. How does it work? The college is divided into 3 levels that are reached by earning ESCO credits. Once you are selected for one activity based on competitive application, you become eligible to become an ESCO student. Once you already achieved 100 points, then you become an ESCO fellow. And in order to become an ESCO graduate, you need to accumulate 500 ESCO credits. How do you accumulate points? It's easy. By participating in ESO activities, courses, fellowships, postgraduate program, ESO sessions, but also by professional achievements outside the school, taking part into certification exams, publishing, having abstracts at conferences, etc. I would not go into the details of which benefits are available for each level of the college, but I invite you to go on our website and do that. I will just focus that here on the bottom of the slide, you see the improving outcomes in leadership course. We believe that once our students have passed through the 3 levels, they deserve to be skilled in something else that only medical oncology. So the target for this course is mid-career oncology professionals who have finished training and have a stable position, and they are prepared to take on initiatives and leadership responsibilities. The skills that we want to help them develop is to develop strategic plans, to collaborate in relevant applied health research, to develop implementation approaches to support change management, and to influence authorities, governments, and politicians to be able to actually improve cancer care in their own environment. We also promoted through this course sharing of best practices across Europe, and also wanted to create a network of trained individuals who will continue to work together to improve cancer patient outcomes. So I will briefly describe the course. We had in-person event, plenary sessions, and we had also a number of breakout sessions. In the event itself, you see here a number of topics that were discussed. Clinical leadership for effective multidisciplinary cancer care, integrative supportive and palliative care, how to explain the benefits of a clinical trial to a patient, and value-based clinical decision-making are just some examples. But what I cannot capture in this slide was the nice atmosphere and the interaction that took place throughout this meeting. Participants were very well attracted by the subject, and they were very active in interacting with the faculty that provided these lectures. We also organized 4 breakout sessions, and in this breakout session, the participants were the ones presenting an example of practice that had changed outcome or did not, and they presented their project, followed by the discussion with the participants and the faculty members to develop institution country-specific proposals for improving outcomes. Here is just a list of some of the topics from one of the breakout sessions, and also these were an extremely interesting experience to realize how much is already done with the existing resources. What have we learned from this project? We have learned that, and from this discussion, that each challenge and project and context is distinct and requires some unique solutions, but also that we can do better even within the existing resources. And there are some common themes which suggest some common solution that I will not go into the details. But overall, there are plans to actually use the experience of the interaction during this improving outcomes and leadership course to develop materials for the future. So I think the school is very satisfied with this event. I think the participants were very excited. Some of them said it was the best event organized by the school ever. And for that reason, I wanted to share with you that, and actually I'm looking forward to the presentation of my colleague Maha, who will tell you from the perspective of the participant her experience with the European School of Oncology. Thank you very much for watching.
Hello, my name is Maha AlSendi. I'm a medical oncologist and a breast specialist working in Salmania Medical Complex in the Kingdom of Bahrain. I'm very honored to be part of the OncoAlert Colloquium and to be able to present to you my experience in attending the Improving Cancer Outcomes and Leadership course and ESO Eco SPCC European Initiative. First of all, I'd like to discuss with you the reasons I have enrolled in the course. Bahrain is a small island in the Middle East with a population just under 2 million. Cancer is one of the leading causes of death in Bahrain, and outcomes of patients in comparison to other high-income countries are not comparable. Although there have been a lot of progress in cancer care in Bahrain with the establishment of Bahrain Oncology Center, we all know as medical oncologists there is always room for improvement. There are many areas of inequalities in cancer care, and this is a fact that is present worldwide, from prevention to screening, to prompt diagnosis and prompt access to care, to having enough qualified trained physicians and access to multidisciplinary specialized care, to other areas which are not available worldwide or not available in many countries, such as access to clinical trial, research, and innovation. During the course or prior to the course, we were given a task to discuss a project or a proposal that we were involved in, or a leadership role that we assumed that led to an improvement, or even if it did not, we were asked to discuss the challenges and reasons that the project did not succeed. My proposed project was the establishment of an oral chemotherapy clinic, which was nurse-led. Just to give you a little brief, the current situation in the clinic is that patients who require any new oral systemic anti-cancer therapy are briefly educated by physicians in the clinic and then started on oral systemic anti-cancer therapy after appropriate investigations. This may require multiple visits to start a treatment. Furthermore, due to the COVID pandemic, walk-in clinics are no longer in service. Therefore, often patients have trouble reaching the team. This led to unnecessary visits to the emergency department for routine complaints and furthermore, constraints on the health system. Therefore, the proposal was to have an outpatient clinic dedicated to manage patients who are starting any new oral anti-cancer systemic therapy. This would be led by an experienced oncology nurse and a team member, in which patients who are starting any new treatment will be educated, given written information, and also have their baseline investigations done. This will be reviewed, approved by the physician prior to treatment, and when patients receive their prescription, the nurse will review the medications again with the patient and/or their caregivers and go over issues relates to the administration of the medication, such as how and when to take the prescribed medicine, what to do if doses are missed, explanation of side effects, and as well how to manage them, and how to safely handle the medication. Of course, there are many benefits to having this clinic, such as patients who experience side effects and toxicity will have a direct link with the nurse and can access the team members easily. It will help improve and manage an adherence and reduce waste at time of refill. Furthermore, when patients can effectively identify, manage, and report their side effects, their ability to continue the medication for a longer duration improves. Unfortunately, this was not initially accepted or approved by the head of the department for many reasons. Some of them were that it was felt that the nurses were not trained or qualified enough to be able to manage the clinic. We had issue with staffing and availability of rooms in the outpatient department. One of the areas that we discussed in the course is how important data is. Therefore, we collected data of the last 12 months of patients who were started or any new anti-cancer systemic therapy, oral systemic therapy. We also did a survey regarding our proposal to patients to see if this would be accepted. The results of our audit included that 18% were taking the wrong schedule of medication at a given time. 20% had at least one visit to the emergency department to manage a side effect. 45% of patients reported that they had a side effect that they did not disclose to the physician. And 76% of patients reported that they would feel as satisfied if they were followed by a well-experienced nurse as they would with a physician. Furthermore, 85% reported that 85% of patients preferred if they had a point of contact or a helpline to contact in case of any questions or to report any side effects. Once we presented this data again to the head of the department, our proposal was approved. So in front of you, you see the checklist for documentation of oral chemotherapy adherence and toxicity. We plan to monitor after 3 months of starting this project, and our outcomes would be to see the visits to the emergency department, and also look at toxicity and dose reductions, and also patient-reported outcome and overall satisfaction of patients with the oral chemotherapy clinic. Other projects that we discussed during our time in the course, I'm just going to discuss some of them. There were many good projects, and there was a lot of discussion that was very beneficial. Some of the projects included establishment of a breast cancer unit in Romania. This was presented by a breast medical oncologist. Virtual National Tumor Board in Albania. That was presented by another medical oncologist. Safe and enhanced post-operative cancer pathways, presented by an ICU staff nurse from Portugal. Quality of life and cancer-related cachexia, presented by a medical oncologist from Egypt. Enhancing patient-provider communication through patient education and empowerment at the National Cancer and the National Center of Oncology of Armenia. This was presented by a patient advocate. Establishing a new thoracic surgery department in Greece in the era of financial crisis, which was presented by a thoracic surgeon. Finally, I would like to thank the European School of Oncology for their efforts to provide health professionals like myself with the tools to improve cancer care in an effort to close the care gap worldwide.
Dear colleagues, thank you very much for joining us on this OncoAlert Colloquium. We hope that you have enjoyed it as much as we have enjoyed making it, and reminding you that this week was just the beginning. We want to make sure that these presentations reach every oncologist worldwide and that this information is used. It is for this reason that we have made it easy and possible to share the links. You can just copy-paste the YouTube links, and there is no sign-up. You can also go to our website at OncoAlert360.com and find the links there. No tracking of data, there is no registration, precisely because we feel information should be easy to access and available for all. Thank you very much on behalf of OncoAlert, our partners, our faculty, and reminding you that no matter where you are, we're all OncoAlert.